Melissa?
Here.
And Courtney?
Here.
Okay. I need an approval or corrections to the June 9th, minutes from last month.
Any corrections? I'll make a motion to approve the minutes from the June 9th, 2026 meeting.
I need a second.
I'll second.
All in favor?
Aye.
Moving on to old business, dog licenses, I see we're up to 399, and for cats, we're up to 71. Or actually, we're down to 71, from last year. Where are we standing with notifications and summonses?
We are still waiting to finalize the licensing list.
Okay.
There have been some issues with the licensing program that we use. It was hacked about a month ago, SDL as a platform, and so there have been new security measures put in place that haven't necessarily rolled out how they would have expected, and so when, the person had come to the borough to try to do some of this the last time, SDL wasn't working, so
Okay.
we're still working on finalizing that list.
And we adopted the ordinance of 26-13, ordinance of the Board of Health of the Borough of Rockaway, County of Morris, State of New Jersey, amending chapter 261, health and sanitation to revise the schedule of permit and license fees. Was that just the first reading the last time?
Yes, this is the second.
Okay, so this was the second reading. Any, questions on that ordinance? If not, I need a motion to approve the ordinance with the changes that we made.
Motion to approve the ordinance.
And I need a second.
I'll second.
All in favor?
Aye.
Do we have to open to the public on that? Is it just approved by the board?
I think it's just approved by the board.
Fair.
Can you guys speak up a little bit? It's very hard to hear you.
What did you miss, Bonnie?
I don't know what I missed, but just if we could just speak like a little louder, I'd appreciate it.
Moving on to new business.
So I briefly just wanted to touch on cyclosporiasis, which is all over the news.
Oh, it is.
Cyclosporiasis is not new. We every year experience a handful of cases locally that get investigated by the public health nurses. It's by no means common, but we see it normally in the summer. So the season for cyclosporiasis is May through August, with the period of time, June and July being the time we kind of see an uptick in cases. I know that it's all over the news. There is currently no increase in cases here in New Jersey currently. So the same precautions apply. Washing your hands, washing your produce. That's normally where people contract cyclosporiasis, is from produce or through contaminated water. So sometimes we see it associated with people swimming in a lake or a pool, not normally a pool, a lake or an open body of water that may have that parasite in it, or from not washing produce. So funding for this division at the CDC was cut, and so their job was really to surveil these kind of outbreaks and sources, and so that currently isn't being done, which I think may have contributed to this increase in cases, and it being all over the news. So this is not a new thing. We have seen it at the local level. interviews. We're doing comprehensive interviews that then go back to the state and were previously sent down to the CDC for them to really see if there were commonalities in exposure or sources of outbreak. So I just wanted to touch on that. So as of now, everything is normal here in New Jersey with the cases that we normally and typically see throughout this time period. And then I also just did want to touch on, we are planning and working through planning flu clinics. So we will be carrying the respiratory virus vaccines this year. So we'll get new flu, new COVID, we'll have RSV, we'll have pneumococcal that we'll be able to offer to those with or without insurance. And so we don't have dates yet, but we're working through ordering vaccine and working on scheduling out those clinics.
I have a question. So how many cases in New Jersey of the Cyclosporiasis?
Currently, yeah.
Oh, okay.
Yeah, we don't, the way that it works is that we can only see diseases within our jurisdictions.
Okay.
And unless the number is large enough, they don't release that because then people become identifiable.
Oh, okay.
It seemed like the majority was in the Midwest.
Yes, yes.
And
That's
which-
currently where we're
the
seeing.
farms are, is that?
It could be. It's kind of hard to tell because there is no sort of like federal division working on this and what the exact exposure may be. So I've seen, I actually had a colleague say to me yesterday, I can't eat blueberries because, you know, they might be a source, and I understand that sometimes watching the news creates a little bit of panic, but.
Yeah, I thought funny eating my salad this afternoon. I really did. I was like, did I wash this thoroughly enough?
Right, and so as long as you're washing, you should be addressing any issues.
And I read as long as it stays refrigerated, which that I thought was something new.
Yes, so, and that's part of the reason why we also talk about, you know, particularly in the summer, if you're having barbecues, not leaving food out, and it becomes a, you know, hot potato salad becomes a breeding ground for bacteria, so. Just following just general normal food safety tips is important.
These are not left out.
How does this side go? Any other new business? Any correspondence? We'll open it to the public. The public comment provides members of the public with an opportunity to offer input to the Board of Health on matters of public concern. Each speaker may speak once during the public comment period and is limited to 3 minutes. Comments should be directed to the Board of Health as a whole and presented in an appropriate manner. Speakers are asked to refrain from personal or disparaging remarks about the board members, employees, or appointed officials, as the board is legally restricted from responding to personal related matters. All comments will be received and considered by the Board of Health. The board may, but is not required to respond. So we're opening up to you now, Bonnie.
Okay, basically I have 3 questions, and the 3 of them I did ask last month, and I see that nothing has changed. Number 1 was the open public session. I asked if it could please be put after your reports, so if I had any questions on the reports, that would make sense that I would be able to ask them. But I see there's been no change to the agenda, so I'd like to know why, and if you'd consider that, or what's the problem with that?
We can take it into consideration.
The other thing was, I said that you obviously are missing a person from the agenda here, or from your roll call membership, and that I wanted to know if she resigned or whatever happened, and that I, you know, recommended that there should be an announcement if there was a letter of resignation or there's somebody is missing from the board.
I don't have that information, Bonnie.
I mean, you had a month to get it, there's no, I mean, it doesn't matter what I say or whatever, it's just we take it into consideration and nothing changes?
There was a letter of resignation that went to the mayor.
But don't you think here at the Board of Health, they should announce it, that there was a letter of resignation and that the membership has changed? The name just comes off the top and that's it? Is that how we do things?
There's definitely a vacancy, for sure.
Yeah, but it also should be announced if the person resigned. Or whatever. It always has been in that way in the past. And the last thing was, you were supposed to get back to me on the infectious disease. I asked you, mentioned 3 infectious diseases, and you said that you would get back to me, and I never heard from you on that either.
So when the numbers are this small, the concern is that these people become identifiable. So if there were outbreaks or clusters associated with infectious disease, that would be brought to the board's attention.
You could have told me that too, a little email or something would have been nice, would have been professional. You guys just don't want to respond. But that's okay. I'll take that into consideration too. Very good. That's really all I have now. But I'm very disappointed in this board. Very disappointed. Especially after last meeting. I thought there'd be maybe one change, one little change, one something. Nothing. But okay. It's okay. Noted.
Anything else, Bonnie?
Absolutely not. Thank you very much.
We're now closing to the public and staff reports.
So for environmental inspections, there was 1 certificate of habitability inspection done, 1 food and drink inspection, 2
Can't hear
kennels-
ya.
2 kennels inspected, and 2 youth camp inspections. As far as Oprah requests, there were 6 billed, 1 summons and a letter issued, and 1 vermin complaint investigated. In terms of the public health nursing, there were 8 children screened for lead, 8 cases closed. There was a child care consultation with TJ Middle School about TB testing related to staff. The Chem 23 profile, which I talked about last meeting, which is the low-cost blood work that will be available for Rockaway Borough residents to participate in, is scheduled for September 18th. That information, along with pricing and date and time, will be put on a flyer and provided to the borough for advertisement. There were 3 communicable diseases reported, 3 diseases investigated. The 317 funded program, so the adult vaccine program, saw 4 adults with 8 immunizations given. The VFC saw 2 children with 4 immunizations given. There were 2 immunization audits of 2 youth camps here, elite martial arts and twisters gymnastics. Both of them were found to be compliant. And the nurses attended some Morris County Public Health Nursing meeting and New Jersey Department of Health Regional Epi call.
Moving on to vouchers, I didn't see any vouchers. And we don't need a closed session. And then moving on for an adjournment if there's no other questions or concerns on the board. I'll take a motion for an adjournment.
Make a motion to adjourn at 6:44.
And take a second.